This is a special report. Welcome to the KY3 COVID-19 Town Hall.
Hey everybody, thanks for being here once again for our third now virtual town hall where we talk to experts about what's happening locally with the coronavirus. Should we be basically shutting down an economy which was doing very well based on models that aren't going to be right?
Right. So the models what the good thing about models is you stop and you regroup. I use the analogy of your gas mileage in your car. If it's 20 miles per gallon, but you're driving uphill, you're going to have different gas mileage. When you get to the top of the hill, you can't use your uphill gas mileage to predict your downhill gas mileage. So hopefully we'll soon be on the downhill and we'll have different data points.
A lot of people saying they're getting a little bit antsy. When do we resume life as normal? When can we get back to business? And how is that going to look, that transition?
So we're taking a good hard look at that right now, Ethan. The data is trending very well. I think it's better than any of us really expected. But we can't really take our foot off of the gas.
Let's go over to Chief Williams now and talk about enforcement a little bit. Chief, I know people are talking about what happened last week when one of your officers wrote citations for several motorcyclists who were apparently in the parking lot of a convenience store. Some people, I'm sure you've heard about it, are not happy about that, thinking it's a little bit heavy-handed of the police department to be writing tickets for people who were in the parking lot of what is an essential business, a convenience store. What can you tell us about what happened there?
So let me talk about enforcement in general. The police department is the enforcement arm of the city. So even though this is a health emergency and there's a civil emergency, the health department's driving this, and our economic development and planning departments are advising those essential businesses. But if a violation occurs, it's the police department that's going to have to go out and take some action on that.
Chief, if that's the only situation where you actually issued citations, what was it about that situation that led to the citations?
So I think that's been publicized in a number of different ways, and I would say that the officers that responded to that complaint handled it appropriately, took action that they felt was appropriate, and those folks that were issued the citations, the appropriate venue for arguing their case is certainly within court, not in the court of public opinion, but in the municipal court of Springfield. And I would encourage them to do that if they think it was inappropriate.
How important would you say hope of getting back to normal soon is in helping these people deal with this crisis they're in?
We know that isolation and hopelessness and interpersonal loss all load on suicidal ideations and increased risk for suicide. The thing that we're not talking about in the media right now is the second public health crisis coming, and that's the second curve. And that's going to be an increased amount of mental health conditions and symptoms that our communities will, in fact, encounter.
Clay, we heard your news conference this afternoon where you were talking about you went out to a couple of local stores and you were noticing people wearing masks improperly. Cindy Lubbert would like to know what was wrong with the way they were wearing masks, and how do lay people like us know how to wear a mask properly?
So we probably need to put some guidance out because, quite frankly, I was surprised. In a 30-minute period, just running in to get some essential items, I counted 15 people wearing masks the wrong way. I mean, to use PPE, Dr. Trotman and I'm sure Brent can tell you, it requires training. And people had a mask covering their mouth or only covering their nose or around their neck.
Clay Goddard for this, and this is a viewer that sent in this question talking about the precedent that's being set right now. Do we really think a month from now, 2 or 3 months from now, we won't be seeing a few new cases every day? And then at what point will this ever end?
So this is a disease that's probably going to stalk us for a while. We have tools now that we didn't have before. We have rapid testing. We have the ability to do things that we were unable to do as far as our ICU beds, as far as my capacity to do communicable disease investigations. So that really changes the landscape a little bit, but it's going to be out there for a while, Ethan. And as far as going back to, was it worth closing down an economy? Ask the folks in Northern Italy, ask the folks in New York City. They probably wish they would have gotten on this early. And really, if people say this is not a big deal, that's the ultimate compliment to public health professionals. it means that we and our public health system have done our job the right way. I'm very proud of this community and how we've handled this crisis.
Chief Williams, real quick, are you seeing crime increase in other areas or any areas now that everybody's kind of at home?
We're seeing some decreases in some property crimes. Did a study comparing last March to this March in our burglaries, and there's a substantial decline. Anecdotally, you'd say, well, people are home, so it's hard for someone to break into your home when you're there. So I anticipated that. We are not seeing the substantial increase in violent crime, specifically domestic-related interpersonal crime that we thought we might see, and I'm hoping that continues.
So we want to thank all of you for being part of this again tonight. We think it's been very educational for our audience. We've gotten a lot of good responses. Heather Lewis and our friends over at Color 10, thank you for being with us again and partnering with us. We appreciate how we're all able to work together to try to wrap this up and move on to our normal life. It's been a pleasure for us to bring it to you.